top of the screen. There is also a fast pass option throughout the system. Say an agent did want to just get to the plans list page and see the plans within that beneficiary service area before creating a profile. At the top of the screen, we do also have a plans button. If we were to select that, it would open up a window prompting us to enter that beneficiary zip code, and it would take us directly to the plans list page. Also, always in the upper right-hand corner, the agent will be able to view their name. Today, I'm working as broker test, but if I was to select my name here, I actually do have the ability to go into my account overview. A few important things that are found in the account overview, and I do like to stress to agents to always come here first, because under the account information, the agents will be able to view their active selling permissions, so the carriers that they're certified and licensed to sell through you as the agency. That is very important because when they do get to the plans list page, they're going to be able to want to electronically quote as well as electronically enroll in those plans they are certified and licensed to sell. A few other features within the account overview, agents do have the ability to actually upload a picture of themselves. So any outbound communication from our system, such as a quote or any emails that are sent, that picture will be included. So just more of a personalized approach between the agent and the consumer. Also, within the account overview, the agents will have access to their own personalized shopping link. This is a copy link. So if we were to select that, we would be notified that it was copied. And we could actually send this link out to an individual in our book of business, and it would take that individual to the consumer-facing site where they could shop and enroll in a plan on their own. And if they were to enroll in a plan from an agent's personalized shopping link, that agent would get credit for the enrollment. So a few neat tools here found under the account overview in the upper right-hand corner. Again, we do want to stress the searching of a beneficiary. So if we were to come in here and search on, say, someone named John, it will pull up every John in the system. As we do add more criteria to search on, that search will get more specific. But say maybe, for instance, we're uncertain if we have built out a profile for the individual we're talking to. So we search on a first name, last name, date of birth, phone number, email address, and for some reason no results are found. We could actually create a profile off of the information we searched. So really streamlining the process for agents where they're not rekeying in information they've already entered into the system. Say we do go ahead here and maybe search on John Smith. Within the search results, we can see that there is one profile built out for John. And if we were to select his name, this is where we will be taken to his profile. One thing I do like to stress to agents within this profile window is to actually fill in as much information as possible because information will pre-populate throughout the system. Specifically when that agent gets to the carrier's electronic enrollment form, they're not going to have to rekey in this information again. It will populate on the first page of the enrollment form for them. Also, we do have a call out on the right-hand side of the screen to any notes as well as tasks. So if there is something specific the agent does want to save to this profile, that can be done on the right. And as we do actually move throughout the system and perform a few functions, notes will start to pre-populate in here for the agent. So really showing them what they have completed with this specific beneficiary thus far. Also within the profile, we will show a quote history, so any electronic quotes sent to the beneficiary in the past, as well as enrollment history. So the agent can actually view a past enrollment. They could view that application in a PDF form and maybe any documents they've uploaded to the enrollment. And as you can see here, they can also continue on through an enrollment as well. So say we got halfway through the enrollment form with John Smith and he had to leave the meeting. When we do have that follow-up, we can search his name in the search beneficiaries window. select continue enrollment, and it will take us as the agent directly to that enrollment form where we can fill in the additional information and then submit the app. Once we have gone ahead here and now built out this profile, at the bottom of the screen, we can now continue on to collect the scope of appointment. We do have a few ways to collect the scope within the system. If us as the agent have our own scope form, we could upload that back into the system. We could choose to print a consumer form and upload that back into the system, as well as we give agents the ability to send off an electronic scope of appointment, either via email as well as text, so giving them as many options as possible. As you can see, the email and phone number have pre-populated from the profile. And if we did say want to email off the scope, us as the agent would just need to select email SOA, where we will be notified back into the system immediately that that scope has been sent. Now I'll actually show you what it would look like from the beneficiary's view. So if we were to come in here and just check our email, this is the email that they would receive. So, hi, John, I'm looking forward to meeting with you. And again, at the bottom of every email that is sent from our system, that agent's information will be visible. So if that beneficiary is confused, they could give their agent a call, send them an email. That information will be provided here along with their photo. But now that beneficiary will just select complete scope of appointment form within the email, where they will be redirected out to that electronic scope. And here they'll need to fill in a few required fields. So the products they want the agent to discuss, their beneficiary first name, last name. We'll just go ahead and populate this. Put that in. State, zip code, and then we'll provide an attestation at the bottom of the screen. Once we've completed these fields as the beneficiary, we could go ahead and submit the form, where we will be notified here that that scope has been submitted. Once the beneficiary actually submits the form, the agent will receive an email on their end letting them know, hey, John Smith completed that SOA, log in to view that scope. So we'll actually just come back into the system here and just hit refresh on the screen. And we will be able to see that that scope was completed by John Smith. And now us as the agent will need to go in on the right-hand side of the screen and complete the rest of the form, where the agent's first name and last name will pre-populate, the initial method of contact, the plans that were represented during the meeting, an attestation at the bottom of the screen, and now we could go ahead and submit the broker form where, again, in real time, we will show that that scope has been completed, and we can now view a PDF copy of that electronic scope here as well. If we did say send it off via text, it would operate almost the same, where that beneficiary would receive a text message to their phone with a URL. Once they select that URL, they will be taken out to their phone's browser, where they will complete the same scope and submit it. Once we have gone through the process here and collected that scope from the beneficiary, at the bottom of the screen, us as the agent have two options. We could begin to add preferences on the beneficiary, or we could continue to plans first and get more of a high-level view before we start to add preferences. So I'll actually continue to plans first. This will now take us to the plans list page. So the plans that that agent is certified and licensed to sell through you guys within the specific beneficiary zip code. Of course, the agents do also have the option to add in non-licensed plans. So it would show all the plans within this beneficiary zip code, but again, they will only have the ability to electronically quote, as well as electronically add plans to cart that they are certified and licensed to sell through you. So very important there. They can get a view of all of them, but again, can only quote and enroll plans that are licensed to sell. From this page, the agents will have many options. They can look at the different plan types at the top of the screen. So if they're looking for a MAPD plan, MA, PDP, Med Sup, those will be broken out. They'll have different sorting abilities if they wanted to sort by plan premium, total estimated cost, star rating, plan name. Those options are available. They could choose to view an individual plan's details. They could add to quote a plan electronically to the beneficiary. They could add to cart and begin the enrollment process, as well as they can always choose to check up to 3 plans to compare side by side. However, again, this is just a high-level view of the plans. That agent does always have the ability here on the left-hand side of the screen to begin to add preferences, and that's what we will do now. So we'll select Add Preferences, which will take us to more of a guided shopping workflow. We will land on the Get Started page where it will pre-populate that beneficiary zip code from the profile, what coverage type they're interested in, and then a subsidy level question. Again, what we do answer here will be reflected back on the plans list page. Next is health status. So the health status is used to calculate estimated costs. It will not affect plan premiums at all. And we bucket this into 3 categories. So generally healthy, some health needs, and significant health needs. And we do supply the definitions to those right below for the agents to view, as well as age range. If we have gone ahead and entered the beneficiary's date of birth within their profile, this age range will pre-fill. So from this page, we are determining utilization of the plans. Next is prescription. So a very important piece of the technology here. We do have the ability to save a beneficiary's drug list year over year within our system. So building out that medicine cabinet in the beginning is extremely important. I know drugs can sometimes be difficult to spell, so we do have a smart lookup tool. So if we were to start typing a few letters of a certain drug, it will start to pre-populate here, where we could select, say, Namenda, for example, where it will pull up the most common dosage as well as quantity, but of course we can make those changes if they are taking something different. And if there is a direct generic available, we will show that direct generic and the ability to switch to that generic for likely savings. So if we did want to add that generic, we would select yes and add that drug into the medicine cabinet. I'll just add one more for the demonstration today. So we'll say Eroxitrol. We'll add the generic. Also, we have rolled out a new feature, another way to collect the beneficiary's drug list, and that is through Blue Button integration. So if the beneficiary does have a MyMedicare.gov account, we can use Blue Button. As you can see here, the email address has pre-populated from the profile. And if we did want to use Blue Button, we would select Send Email, where we would be notified that we are now waiting for access. The beneficiary will receive an email prompting them to log into their MyMedicare.gov account. Once they log in, they'll allow access back into our system. And once that's done, it will populate the last 18 months of that beneficiary's claims data right into this window for the agents. So really saving them time if they do know that beneficiary has a large drug list where they're not going to have to go in and enter those drugs manually one by one. However, whether we choose to enter drugs manually using the Smart Lookup tool or bring in drugs via Blue Button integration, us as the agent can always come back to this window and edit a dosage or quantity. We can delete drugs out of the medicine cabinet if they're maybe no longer taking them. And again, we can always continue to manually add drugs using the Smart Lookup tool. Next is the pharmacy. So here we do actually have the ability to add more than one pharmacy now. So once we actually enter a zip code, it will pull in those pharmacies within this specific zip code. If for some reason, like we just had, it wasn't pulling in pharmacies, we can actually move in and out on the map. It will pull in those pharmacies there, or we could actually go ahead and maybe select, say, a Giant Eagle, and we'll select a Signature Health. Once we have maybe selected more than one, we could designate which one is the primary pharmacy. And once we land back on that plans list page, we'll be able to see with those drugs we've entered, as well as the pharmacies, if they're covered or not for the plan shown. So I'll actually now continue back to the plans list page. Once we do land back on that plans list page, we will still have the same options as we did before adding preferences. But now we can see those preferences on the left-hand side of the screen. We can always go in and edit those preference windows. And there is also a fast pass option throughout the system for the agents. Once they are working on a beneficiary's profile, that individual's name will be shown at the top of the screen. And if we do select their name, a drop-down for each page of the system will show. So just making it very easy for the agents to navigate throughout the site itself. But since we have gone through the process of adding preferences, these plan cards have become much more robust with information. We're showing the two prescriptions we've entered are both covered for this Cigna plan. The pharmacy, Giant Eagle, the primary pharmacy we have selected, is preferred in network, but maybe we did want to see the costs with Signature Health. We actually do have a filter now on the left-hand side of the screen, and it will pull in that information immediately. So we can see Giant Eagle is preferred in network versus Signature being standard in network. We're showing an estimated drug cost, a total estimated cost, so showing a lot of information up front to these agents before they do dive into the specific details of a plan. As I did mention, we can always choose to check up to 3 plans to compare side by side by using the Add to Compare checkbox. So I'll just select these top 3 here, and then I can hit any of the Compare Now buttons, which will take us to the plan comparison page. From this plan comparison window, it will check and highlight to show plan differences across the board in yellow, just breaking that out very easily for the agents to view. And we will break out the plan details into a few sections. So the costs, the plan benefits, the preferences we have added, as well as if there is any optional add-on coverage available, that would be shown below the preferences. And of course, that add-on coverage can be selected from the cart. So if there is that add-on coverage, we can view those specific details here or within the cart window. From this plan comparison page, we can choose to send a multi-plan quote to the beneficiary. We could add one of these plans to cart and begin the enrollment process, as well as we could dive a little bit deeper into a specific plan by selecting plan details. This will take us to a one-off view of what we saw on the previous screen, but there will be 2 other tabs at the top of the page for the agents to view. One being prescriptions and one being total costs. Underneath prescriptions, the agent will be able to view a tier breakout as well as the costs associated with each of those drugs. They can also look at this information based on the pharmacies they have selected as well as mail order. And under total costs, we'd be able to see that total estimated annual cost number, And we could see a breakout by month, so where those costs are going to fall for this beneficiary throughout the year. And we can now also change the effective date, which will update the information shown below. Of course, from plan details, we do also have the ability to just send off an individual quote, as well as add this specific plan to cart and begin the enrollment process. As I did mention, we can choose to send a multi-plan quote. That can be done from this plan comparison page, as well as we could send a multi-plan quote back on the plans list page as well, using the add to quote button. And we do have the ability to quote up to 3 plans as well. But if we were just to select 2, we can see those 2 plans at the top of the screen now. If these are the plans we want to quote, us as the agent would select send quote on the right-hand side here, where it would pre-populate that beneficiary's email address from the profile, as well as an area for the agent to write a custom message to the beneficiary. And now, since we do also support the ability to select more than one pharmacy, the agent has the option to choose which pharmacy they want to send the quote on. So we saw Giant Eagle was a preferred in network. We'll keep that one checked and go ahead and send the quote. Now, this is very important because it is a CMS compliance rule. The beneficiary will receive 2 emails, one being an authorization code and one being the quote itself. But we will show that authorization code here, as well as back under quote history for the agent to view. So if that beneficiary is confused at any point in the process or maybe has lost their authorization code, the agent can easily assist them. But since we have now sent that quote, I'll show you what the beneficiary would see. So we'll check our email here, where they've received that one email with that authorization code. So they'll either need to write this down or copy and paste it. And then the second email with the quote itself. So, hi, John, I have a quote for you. John would then select view quote within the email, where he would be redirected out to a landing page. Not that one, that was just for demo purposes. But on the landing page here, he will need to enter that authorization code he's received and then continue in to view the quote. He'll actually have the ability to view a little bit more than just those plans the agent has decided to quote to him. He'll actually have the ability to view the preferences that agent has entered on him up until that point. Say John is taking a new prescription since he last spoke to his agent. He could actually go in and edit this information and maybe add a new drug. And that new drug would be reflected within the broker site. And now he could go down and view those plans that the agent has quoted to him. John could choose to view the individual plan details, just like we did as an agent. He could choose to compare these plans side by side, just like we did as an agent. If for some reason these 2 plans don't fit his needs, John could choose to shop all available plans, which would only show him the plans that that agent is certified and licensed to sell. And then John could actually decide to add one of these plans to cart and go through the enrollment process on his own. And if he was to enroll in a plan from a quote an agent has sent him, then that agent would get credit for the enrollment. So this is a very popular method right now in the times we're living in with COVID. Having the ability to send this information off to a beneficiary, allowing them to digest it, and possibly make a plan selection on their own where the agent would still get credit. And if a beneficiary is sent somewhere in our system, such as that electronic scope or this quote here, that agent's information will always be at the top of the screen for them to view. If they do need any help, they can give their broker a call or send them an email. So we now have sent that quote off to John. Say he's looked at all the plans and he knows what plan he wants to enroll in, but he doesn't feel comfortable enrolling on his own. So he reaches back out to us as the agent and says, you know what, this Signature Choice plan, that's the one for me. Us as the agent could select add to cart. Before we do hit the carrier-specific electronic enrollment form, we are sent to a cart where we could view the details of the plan we've selected, as well as change or remove the plan from the cart and select another. And if there is any optional add-on coverage available, the agents will have the ability to select from that, as well as view the details. And if they were to select an optional add-on coverage, it would update the total monthly premium here at the bottom. Once we have gone through, reviewed the cart, made sure everything is all good, we do have two options as an agent. If we are, say, sitting face-to-face with the beneficiary, we would choose to complete and submit the form myself. This would allow us as the agent to go through the entire enrollment form with that beneficiary, collect their wet signature sitting face-to-face, and then submit the application. However, if we are not sitting face-to-face, we do offer an option to send to beneficiary to sign and submit. This would allow us as the agent to go through the entire enrollment form up into the wet signature and would give us the option to send off the enrollment form either via email or text to collect that beneficiary's wet signature and submission. So giving agents as many ways as possible to get their beneficiaries enrolled. If we did, say, choose to send a beneficiary to sign and submit, when that individual opens up the enrollment form, they'll actually be taken directly to the review and submit page where they will have the ability to actually review all the information the agent has entered on them up into that point. And the way they would access the enrollment form would be very, very similar to the quote where they'd receive one code with an authorization code and then one message with the enrollment form itself where they'll be taken to a landing page where they'll need to enter that to view the enrollment. But I'll actually go ahead here and select complete and submit the form myself, where I will continue to apply. And this is where we will be taken to that carrier-specific electronic enrollment form. One thing to mention here is, of course, each carrier's form will vary slightly, but some things that will remain the same. At the top of the screen, those agents will have a progress bar, so giving them visibility into where they are in the enrollment process, as well as the shopping cart on the right-hand side of the screen, so giving them visibility, just ensuring them that they have selected the correct plan for the beneficiary. But since we have added a majority of this information to the profile, it has pre-populated here for us on the first page of the enrollment form. If we try to move on to the next page and haven't entered a required field, it will not allow the agents to move forward. So really making sure we do have all of that correct information before we move forward in the process. We do also have areas of additional information. So if we were to want to add a separate mailing address, we can select yes, or we could add in that information. Oh, looks like it's frozen. Just make a change here, sorry about that. Next would be the benefits information, so the entering in of the Medicare number. So we'll go ahead and enter that here. The Part A effective date, Part B effective date, the special enrollment period reasons. We do have hover over question marks, just breaking out some additional details for the agents if they do need that. And then any OEC file format questions here. So understand with each carrier's enrollment form, additional yes, no questions will apply. Next would be other information, so some additional employment information, questions, physician selection, so a link out to the carrier-specific provider directory and an area to enter that, as well as the ability to email off certain information such as plan formulary, summary of benefits, evidence of coverage, and then how they'd like to pay for their plan premium. So this will vary depending on the carrier and what they do support. Next would be the agent information, so an attestation that they are the writing agent, so they will need to provide that attestation here, how the enrollment was completed, and maybe any additional notes. And once they do actually add in that information, we could select next where we will be taken to the review and submit. So a very important piece of the process, whether we are sitting face-to-face with that beneficiary or we do choose to send it to them to sign and submit, because we want to make sure all of that information is correct before we do actually submit the application. We have each page here that we have completed broken out for the agents to view. So we have those drop downs. They could check all that information, maybe edit any incorrect information. Next, we would then have all of the legal terms with an attestation. And then this is where we would collect that beneficiary's wet signature. One thing to mention in regards to this site, it is fully responsive. So if us as the agent or the beneficiary was working on a cell phone or a tablet or even a laptop, the site again is fully responsive, so the UX will render that to that specific device type. So if we were to provide or collect a wet signature here on a phone or a tablet, they could use a finger or a stylus. If they were on a laptop like I am now, that wet signature can be collected with the mouse. Once we have gone ahead here, provided all this information, reviewed it, collected the wet signature, now at the bottom of the screen, we do have that ability to submit the application, where us as the agent will be taken to a confirmation page, so showing us the pending coverage, some additional application details such as a confirmation number, as well as the ability to view that submitted application in a PDF form. And here we can also send off an additional email of this confirmation to maybe a family member or spouse, as well as we do also have the ability to print this page as well. Since we have now gone through that enrollment process with John, if we were to go toggle back to his profile, we'll see some additional information here. Now, within the right-hand side of the screen under notes, we can see that we did send an SOA via email. We did send off an email for Blue Button integration. If we were to send off the enrollment form, it will tell us if we send it off via email or text and the associated authorization code with that. We're now showing that additional quote we sent to John along with that authorization code. And we can now view the enrollment history. So the plan we've enrolled John in, the date it was submitted on, the confirmation number, as well as the ability to view that submitted application in a PDF form as well. So that would take you from start to finish throughout the enrollment process within the broker site. We've added in many new features just to help agents work, such as the ability to collect the scope of appointment either via email or text, Blue Button integration, as well as the ability to send off the enrollment form either via email or text as well to collect that beneficiary's wet signature and submission. So with that being said, I do want to now toggle over to just show you some additional details that we were speaking to a little bit earlier, or Val was speaking to, such as the integrated provider search, as well as